Are there any other votes? Announce the results.
Ayes 103, noes 0.
The bill is passed.
Assembly 10,725, Rules Report 485, Committee on Rules. An act to amend the insurance law and the public health law.
A motion by Mr. Steck. The Senate bill is before the House. The Senate bill is advanced. An explanation is requested, Mr. Steck.
Thank you, Mr. Speaker. I want to thank my colleagues in this chamber for their remarks recounting the history, the failed history of drug policy in the United States. I also have read that 80% of the world's supply of opioids is consumed in the United States, and I think we need to focus on the demand side of this equation. Why is that happening? And finally, historically, we can't forget the role of the Vietnam War and what it played in bringing this problem back to our shores. That all having been said, this bill that I am speaking on today is a bill to encourage treatment of people who are addicted and find themselves in extreme circumstances. I, as a very young lawyer, one of the first cases I handled in my field was a discrimination case where I was representing a businesswoman, and at the end of the case we were talking about getting her health insurance protection going forward. And I asked her, why is it so important to you to get this health insurance? And she said, hepatitis C. I said, how did you ever get that? And she said, I was an intravenous drug user. And it hit home to me that these addicts can be cured and they can go on to have success in life with assistance in putting this terrible problem behind them. So what our bill does is several things. The first is to, instead of having OASIS issue criteria, which diagnostic tools for addiction must meet, now all diagnostic tools will have to be approved by OASIS. We can't have situations where one tool is saying you don't have a serious enough problem and another one is, so we're going to have consistency in diagnosis. A second very important part of this bill is that a 5-day supply of medication will be available to treat people without prior insurance approval. These medications are designed to make it easier for a person to withstand withdrawal from addiction, and that puts the addicts in question in position to be amenable to treatment. There is also in this bill, and this is directed at hospitals where people are brought either voluntarily or involuntarily as a result of an overdose, that to begin with, they must be evaluated within 12 hours by law. We never had that standard before. We have it now. In addition, they can be held for 72 hours only so long as either they pose a danger to themselves or to others. And that 72-hour hold is designed to get people in a position where they are sufficiently recovered from withdrawal in order to be in a position to evaluate in their own minds the importance of getting treatment. This is not to substitute for treatment. They are also in this bill going to be advised of the opportunities for treatment. Finally, there are demonstration projects for wraparound services that will provide the individuals in question with access to the multiplicity of services they need to successfully get into a treatment program. So what we are trying to do here is give people the opportunity to participate and to choose voluntary treatment. Clearly, someone who is still in withdrawal stages cannot make an intelligent decision about treatment. And those are the purposes of this bill. The bill does not address the funding issue, which was done in the budget, and I certainly would like to see more funding in this area.
Mr. Graff,
Will the sponsor yield?
will you yield, Mr. Steck?
Absolutely.
1 minute
you.
while folks are moving through.
Okay, we're on the third bill of the series. So this is the last bill that we're dealing with this. And I know you've worked with this, and you've probably had some input into the other two bills, correct?
This particular bill was more of my focus because I had a constituent who was interested in something that this bill does not contain, which is allowing families to petition a court, for example, to get treatment for their family members who are afflicted with this disease.
We're going to get to that. I've got a system here. All right?
But you asked me how I got to it, and that's how I got to it.
All right. So nothing in this legislation deals with enforcement, correct? I mean, we're not talking about increasing any criminal penalties. We're not talking about creating presumptions, right? If a person has 30 or 50 decks of heroin, we're not talking about running sentences consecutively if they bring some type of drug into a correctional institution. We're not talking, and some people have asked about, whether or not we can have somebody is dealing drugs at a rehab center. There should be enhanced sentencing because we're trying to get it out of there. Or we're not talking about, some people have brought up, but death by dealer, where they cause a death. We're not talking about fentanyl, correct? And what they're doing is lacing the heroin with fentanyl, and people are ODing. We're not talking about any of that yet. We don't have any legislation in this package of bills dealing with any of that. Would you agree with that?
Yes, Mr. Graff, and I would say correctly so, because I happened in a former life to have been an assistant district attorney in the Office of the Special Narcotics Prosecutor. And in my experience and from what I've observed as a citizen, the enhanced criminal penalties have been remarkably ineffective in dealing with this issue. So I do not think that it is something that this body should pursue, which is the failed policies of the past.
All right. Well, I'm a retired New York City police officer. I'm also an ex-legal aid attorney. Okay? So it's kind of strange that, you were the prosecutor, I was the defense attorney. But this is a piece of the puzzle that we have to address also. You'd have to agree that we have to look at stopping the drugs from coming to our streets. And that's just a component. I mean, while we were out there, most people in law enforcement concluded that we cannot arrest our way out of this. Okay? We have to focus more on rehab. But this is one piece of the puzzle. You'd have to agree with that.
I would not agree, quite frankly. And in fact, the history of our efforts in third world countries to deal militarily with the influx of drugs into the United States have been remarkably ineffective and have only succeeded in destabilizing these countries.
All right,
I think we need to look at ourselves and have an understanding why 80% of the world's opioids are consumed in this country. I think other nations have access to these things as well. But Mr. Graff, I do not agree with you. I think our criminal penalties, as they exist now, are adequate to deal with this issue. In fact, under President Obama, the federal sentencing guidelines were markedly decreased with respect to crack cocaine.
We're going to agree to disagree. I've got a lot to get through here. I'm sorry. But we have no public service campaign in this bill, do we?
What's that?
Like a public service campaign where we're doing commercials and stuff to try to reach out? And we have nothing in here with school programs on drug prevention, correct?
No, and I think that would be a good idea.
And we have nothing on civil confinement, which I'm talking about, you're familiar with, is the Marchman Act. Would you agree with that?
I agree.
And there's nothing in here about detox wings in jails. So if a person's convicted and he's going through detox, to have separate wings, and the state funded those because they're costing local governments a fortune.
Yes, there's nothing about that bill, and I would note about that either. And I would note parenthetically that our own sheriff in Albany County has been very involved in programs of that nature.
Right. So that's something that we should be looking at and funding. You would agree with that?
I would agree that that's something we should look at.
Okay. And there's nothing in this bill. We had a problem where we had a parent came to us, and her daughter was 14 years old, and she was withdrawing from heroin, and she was brought into the emergency room. And what happened was the hospital told the parents, she's too young for us to detox. And they said, you have to take her home and detox her yourself. Okay, so there's nothing in this bill when it deals with the age of a person trying to be detoxed, is there?
No, but conversely, there is certainly nothing in this bill that would discourage in any way a hospital from handling this issue in a medically appropriate manner. Indeed, that's what this bill encourages.
Okay, and the other problem is throughout the state, when you talk to different hospitals and stuff, the Medicaid reimbursement rate is so low that many of the hospitals have closed their detox centers. So we don't have adequate detox centers throughout the state. And there's a problem because we don't give adequate reimbursement. And this bill doesn't do anything to help reimburse the hospitals so that we can get more detox centers open. Would you agree with that?
Yes, I would agree. And in fact, I believe both the Assembly and Senate proposals in the budget included a greater increase in treatment funding than what was ultimately adopted.
Okay. And now, under this bill, too, another problem was, the use of Narcan, right, that the ambulances are using and the fire departments and the police department can be very expensive, all right? Are we doing anything to help to reimburse them for the use or pay for Narcan to go on ambulances, go on, so it's not a burden to the fire companies that we have. It's not a burden to the counties or the little village police departments or the schools. Are we doing anything to make sure that we can reimburse them or provide this for them?
The focus of this bill is on how individuals who are admitted to hospitals who have overdosed or are clearly in danger as a result of their addiction. That's the focus of this bill. This bill is not intended as a comprehensive effort to regulate every aspect of this problem.
Well, I'm sorry, but you're the cleanup batter in these three bills. You're playing cleanup. Okay, so a lot of the questions they didn't contain there. I'm just asking if
I was never a home run hitter. That wasn't my strength.
Now, what we do deal with is Vivitrol, and what I heard, Vivitrol was very good, right? You get a shot once a month, and it blocks them from getting high, so they're not getting what they want out of it, okay? And I agree with that. Do we talk about any training for the doctors or giving any counseling to the person that they're giving Vivitrol to? Because what happened, they may have a 10-bag habit a day, and all of a sudden we put them on Vivitrol, right? And they're on Vivitrol for a while. And then what happens is they fall off the wagon. So they go right back to that 10 bags, and they wind up overdosing and dying, right? Do we address that with the doctors in this?
The purpose of this bill is not to do that sort of thing. This bill deals with putting people in a position where they can get recommendation for treatment and pursue the possibility of voluntary treatment.
Okay. So now we have a person come into the hospital, right? They overdosed. And we say they're a danger to themselves because they actually died, and we had to bring them back. You would agree that they're a danger to themselves, right?
Well, if they're dead, I didn't understand the question.
The person ODs. They get hit with Narcan. They bring them back.
Okay.
Okay? You would agree they're a danger to themselves.
They are certainly a long-term danger of themselves. There's no question they're badly in need of treatment. But again, this bill deals with the period of time when they're initially admitted to a hospital to stabilize them and give them recommendations for treatment, hopefully when they are stabilized sufficiently to make an intelligent decision about pursuing voluntary treatment.
Yeah,
This is not a bill, Mr. Graff, that would carry out longer-term treatment solutions.
Well, that's the problem that we're hearing. We're hearing out there that what's happening is somebody's child is being brought in a hospital. They've OD'd. They bring them back on Narcan. They stabilize them. They look at the parents, and they say, oh, so sad, too bad. Your child's a heroin addict, and by the way, you know, we're shoving them out the door, right? So, I mean, that's a problem. The other problem that you have here is when we talk about a 72-hour hold, we're talking 3 days. And now, when we were out there, what we were told was the minimum time to actually withdraw from heroin is a minimum of 7 days. And they described the withdrawal from heroin as picture the worst flu you've ever had in your life, multiply it by 100, and understand that you feel pain to the marrow of your bone. And the second you shoot up, that all goes away. So what we're in fact doing by just holding them for 72 hours is at the height of their withdrawal. 3 days in, we're kicking them out of the hospital.
Well, Mr. Graff, I understand your argument, and we do have, this is not, 1960s, we do have medications that are available to ameliorate the withdrawal process, so it is not as severe, and that's one of the reasons we're making these medications available without prior authorization. I do want to talk a bit, though, and answer your question, such as it is a question, about the long-term treatment program. And I've learned a bit in this discussion from my colleagues, Mr. Barron and Ms. Walker, about the fact that if we're going to have treatment that is a longer-term possibility based on a petition, it's going to have to involve a lot more than compulsion. There's going to have to be a lot more parts involved in that process so people really buy into it.
Well, you're familiar with the Marchman Act.
We're not ready for that
Are you
yet.
familiar with the Marchman Act? The Marchman Act that they use in Florida.
You mentioned it to me, yes.
Okay. What happens is, if you put a 72, see, that's the first step. I've got a 72-hour hold, okay, where that gives family members, if we were to institute a Marchman-type act, where families, we give a family the tools to be able to go to court and petition the court to say, my son, my daughter, my husband, whoever it is, their addiction is so bad they cannot function in society. And we're asking the court to place them into rehab. And the court can order that. The person does get a hearing, and it's based on Kendra's law. So in Kendra's law, we have Kendra's hearing. Same premises. We already have that law in the state of New York. But what we're doing here is we have the first piece of the puzzle with the 72 hours, but we don't have the other piece of the puzzle. And the other piece of the puzzle is to bring the courts in, to allow families to go to court, petition the court to make their loved one get the help. And, I mean, we're missing a big piece here, and we're doing a disservice to these people. So I would think that we'd consider that when we move forward. We need that other piece of the puzzle. The other thing is, do we do anything about regulating rehabs? Like hospitals, they have to be accredited. And how about sober homes? Do we do anything with sober homes? Sober homes are basically warehouses now for people. I have one around the corner from me. and it's for people that have drinking problems. And you go by in the summer, and they're sitting out on the lawn around a fire pit having a beer. How's that working out? Do we have anything to regulate sober homes, regulate rehab centers, put them all in compliance, make them be accredited? And do we do anything about making sure that every sober home has a substance abuse counselor that has to be on staff?
What you're talking about is OASIS regulation of all these various treatment programs throughout the state. This is not the purpose of this bill. The purpose of this bill is to deal with people who are admitted to the hospital who in a condition where they're a danger to themselves or to others. And we believe that the evidence has shown that within that 72-hour period, with access to appropriate medication, they can be stabilized sufficiently to make a rational decision as to whether to pursue voluntary treatment.
Mr. Graff, you have extended past your first period.
As Arnold Schwarzenegger says, I'll be back.
You can come back? Is that what you promised me? Mr. Castorina.
On the bill?
On the bill, sir.
I don't think that this bill goes far enough. I think its intent is certainly well placed, but it doesn't go far enough. Mr. Graff spoke briefly about Vivitrol. Vivitrol requires that somebody be without an opioid in their body for a period of 10 to 12 days. And Vivitrol's success rate is extremely high. The problem is that Vivitrol, because it's now become something that's in demand, the pharmaceutical companies have made it so outrageously expensive that nobody can afford it and insurance companies don't want to pay for it. Vivitrol used to be used for alcoholics in the 1960s, and it was cheap. Well, guess what? They changed the brand name, and now you just can't get it for the purpose that it's used for today without an enormous amount of money. So this is a real problem. And we need to call upon the pharmaceutical companies to come into our communities and fund us, give us money to help this problem that they started. They created this problem. They advertised these opioids. They advertised these controlled substances. They were pushed. They went to the doctors and said, you should be prescribing this drug. You should be prescribing that drug, not fully knowing that they would be harming so many people in our communities and putting them in such a terrible position where they're overdosing to the tune of 3-4 a week in my community alone. So we need to call upon them to step up and do what's right, because we can't afford it with a $25 million earmark. It's outrageous. It's just outrageous, and it's unconscionable. So I call upon the pharmaceutical industry to step up and put their money where their mouth is. They want to help make this better? Well, let's see you do it. Come into my community. We don't have beds. We don't have availability. We have to send people down to Florida. And they go 2, 3, 4 times. And they don't get better. Sometimes they do, but sometimes they don't. And when I read the obituaries in my local newspaper, and I see a 22-year-old and a 28-year-old, and it says they died at home, I know why they died, and you know why they died. And we need to do more. So although I agree with the premise of this bill, and I think that it will help save some people, because there will be the ability to refer out individuals who want voluntary treatment, we need more. And I think that Vivitrol is a good drug that can really help us. But we need to make sure that that 10 to 12-day window is going to be appropriately facilitated so that Vivitrol can be accepted by an individual, which will block the addiction, will block the result of an opioid in that person's body. And we also have to make sure, and this is something that I hope to bring forward in the next session if I'm lucky enough to be here, I would like to see that certain individuals that are referring people to rehabs are not able to get kickbacks, are not able to get money for sending people to a particular facility, because that's steering. And they're not acting in the best interest of the individual, of the addict. They're acting in the best interest of their pocket. So we should be mindful of that, and I thank the sponsor for this initiative. Thank you.
Thank you, sir. Mr. Saladino.
Thank you, Mr. Speaker. Would the sponsor yield for a few questions?
Will you yield, Mr. Steck?
Absolutely.
Mr. Steck yields.
Just want to change the direction a little bit. The last two bills that we've been dealing with, heroin and opioid addiction, they obviously passed. Do you recall the vote?
I don't recall the vote, no.
They passed unanimously. And I'm going to assume, I'm not positive, but I'm going to assume your bill will too.
I wouldn't assume that. I think there are individuals who have a problem with the 72-hour hold.
I'll be asking you a few questions, but I think the problem is more about the final product when so many folks in this room on both sides of the aisle have listened to the parents, have listened to the experts, and we have heard of solutions that perhaps this doesn't fully address. And it's probably more about frustration that we're not as far along as we'd like to be. And frankly, that this legislation wasn't done much earlier in the year, and perhaps last year or the year before. And just to form a question, would you agree?
To an extent, but again, as I said before, getting folks who have addictions into long-term treatment programs is much more complex than just saying we're going to have some judge order it.
Yes.
And especially if you've ever participated in the legal system. But I think that we all know that the long-term treatment of these individuals is paramount. We have a lot of cries here for funding, and I would wonder if my colleagues would join me in raising the revenue necessary to do that.
We speak about complication. That's something that gets even more complicated when we talk about how to raise the revenue. But I think so many of us would agree, and I'll ask if you would agree, that so many of us realize that this has to be solved in legislative efforts, but also has to be solved at budget time.
I would agree.
And I think that, would you agree that that's something that everyone in the room understands and hopefully will remember when we get into budget time next year?
I certainly would hope so.
1 minute, gentlemen. I know it's been a long day. It's going to get a lot longer if we can't conduct our business without screaming over each other.
You're so right, Mr. Speaker, and I'll do my part to make my questions briefer and wrap up more quickly. We heard talk about issues like the Marchment Act, PA 106. When we've gone out to listen to the stakeholders, they've told us these issues over and over again. You're cognizant of these bills and the fact that this legislation has worked in other states?
Whether it's worked or not, I can't say. I did read a study that does say that these efforts hold out promise. On the other hand, I'm convinced after conversations with my colleagues that we are probably not in a position yet to enact that type of legislation because there are important elements that have not been considered.
Well, at the risk of disagreeing with you, we actually just passed legislation today that some would see as even better than PA 106. No lifetime limits. So if someone falls off the wagon later on, we come back and actually will help to fund their insurance coverage of their treatment without lifetime limits. I think there's quite an advantage of that, but I would agree with you and others that we have to do more and continue to revisit it. It would be a good idea.
That was already the law beforehand. What we did pass was that there would be no utilization review for the first 14 days, which would guarantee people immediate access.
Yeah, we still have a ways to go, and we still have done some things in terms of getting insurance coverage for these inpatient treatments.
We have a lot to do on a budgetary end. We have a lot to do on an education end to reduce the demand for these substances.
Absolutely. I'm so glad you said that. And to continue on in this productive conversation, and we have a lot more to do to make sure that people who don't want treatment are receive that treatment, that we take the steps in more legislation that would expand on this. So if someone's, say, 17-year-old daughter with a heroin addiction does not want to go, we have a process, perhaps through the family courts, to ensure she gets that treatment. Good idea?
Well, we certainly do similar things with treatment for alcoholism through the DWI laws, but when we're dealing with longer-term treatment for heroin, which has its own special problems, I don't think that there's yet been a bill introduced that would address all people's concerns that we could get a majority of this House to support.
I'm glad you brought up the words legislation that's been introduced. Have you had an opportunity to carefully study the report that the minority spent quite a lot of time working on with the legislative suggestions, the legislative solutions?
I haven't studied that report, but I did work with Senator Orr on the consideration of involuntary treatment, so I know a bit about the subject generally.
Have you been part of the negotiations either this week or recently that have resulted with the Senate that have resulted in this legislation?
That have resulted in this bill?
Yes, what we used to refer to 3 men in the room. Were you part of those negotiations?
I think our entire conference's views were represented by the Speaker in these negotiations.
Will you be pushing for further negotiations on legislation that continues in the vein of this legislation, in the legislation that was presented in that report, and into all of the issues that the experts bring to us?
Absolutely, after consideration with the views of the members of the body.
And would you agree that when we spoke of the issue of that 17-year-old, she's addicted to heroin, her parents tell her you have to go into treatment. She says no, and then sometimes parents who are so frustrated, parents who are fearful that they're going to wipe out their savings, maybe the college fund for all of their children, in that frustration, sometimes they'll throw that child out of the house. That has happened, right?
Well, yes, and in fact, my involvement in this issue came through a parent of a colony student who was in very much the same position, and that parent certainly would like to see more done, like we all would do, but that individual is supportive of the bill.
And that child on the street...
The child is not currently on the street. Actually, after several failed efforts, as I understand it at the present time, some progress has been made.